Welcome viewers on YouTube channel, especially Dr. Vid channel. Today we'll talk about Downer cow syndrome part 2. We have already seen part 1 and its content. In this we will deal with part 2, clinical signs, necropsy finding, diagnosis, differential diagnosis, treatment and control aspect. Clinical signs of Downer cow syndrome. Here, the typical thing is that prolonged recumbency even after two successive calcium therapy. In milk fever cases, we are giving calcium treatment, then there is 80-90% response, animal get up. The cases which are unable to get up, again we are giving second calcium treatment, then most of the cases will recover. But few cases do not respond to even two consecutive calcium therapy and they remain a prolonged recumbency. The animal remain down or prolonged recumbency at least for 24 hours without any apparent reason. That is also a clinical finding. Animal can support on four quarters. They are able to get up and try to rise on four quarters but unable to use its hindquarters. Hindquarters are not working at all. Some animal makes often efforts to rise, but these efforts are unsuccessful. Some marginal cases are able to stand with assistance by owner by lifting tail or head or hip slings. These are the marginal or initial cases of Downer cow syndrome. But when they become down, they make frequent efforts but unable to get up. But they crawl on the chest or abdomen with the four quarters, but hind quarters are not working. And the animal sits just like frog, frog like attitude. In frog, you know that both the hind legs are wide apart. This is called as frog like attitude. Both hind legs are equally spread on both sides of the animal. In some cases, the hind legs are extended on each side and reach up to the elbow joint. It is extended well forward. These cases may be due to dislocation of hip joints. Here, the animal is bright and animal alert also. There is nothing wrong with this animal, but only thing is that unable to get up. Animal eats food and drinks also moderately well. Body temperature is also normal. Heart rate is usually normal or slightly elevated 80 to 100 per minute. Respiration is not affected. There is normal defecation and normal urination also. In urine, clinicians find presence of proteinuria. This indicates there is extensive muscle damage. And muscle damage always occurs because animal remains sitting for a long time, pressure on arteries and vein, and there is ischemic muscle necrosis. Necropsy findings, there is hemorrhage and edema of the skin because of the long time lying down on ground, damage to nerves of the limb again because of the pressure, there is hemorrhage and degeneration of thigh muscles. Pathologically, it is termed as ischemic muscle necrosis. This is the characteristic, and this is the main pathology that makes animal unable to get up. Even if her diagnosis is complete, treatment is complete, all right. But if there is ischemic muscle necrosis, the response to treatment is poor. The response depends on the grade of ischemic muscle necrosis. The heart is dilated and flabby. There is focal myocarditis, fatty degeneration of the liver, adrenal glands are enlarged. That is because of response to stress. Diagnosis, the diagnosis of disease is very easy, not difficult at all to provide the diagnosis of Downer cow syndrome. But here, important thing is etiological diagnosis. That is very much important. Etiological diagnosis is very much essential to plan the treatment. Otherwise, the general treatment will not give any improvement. Of course, it will help, but etiological diagnosis means a rational treatment of the disease and chances of improvement is more. For that etiological diagnosis, proper history and clinical examination, a thorough clinical examination, detailed clinical examination is very important. We should go about the history and clinical examination. For example, in etiology we have seen many etiologies. Complication of hypocalcemic partial paresis. We have to take the history about parturition and parturition time. History about overlong delay in the treatment of milk fever. History about quality and quantity of treatment of milk fever. Clinician must examine the limb muscles, traumatic injuries to hind limb muscles. Clinician should examine traumatic injuries to the nerve of hind limbs. He should take the history of dystocia. So, if etiological diagnosis is proper, then treatment will be very rational. The diagnosis also require laboratory help, estimation of serum electrolytes because electrolyte imbalance or deficiency also causes DCS. Persistent hypophosphatemia, hypokalemia, decreased potassium level with hypophosphatemia, toxemia, diagnosis of the toxemic disease, and malnutrition. So you have seen here that diagnosis of disease is easy, but etiological diagnosis is little bit difficult. It requires patience, examination, and experience. We have seen many etiologies cause disease. At the same time, now we'll see here many diseases also produce similar symptoms of DCS. So, diagnosis of DCS is very complicated, not easy. Here we will see the diseases that are required to be differentiated from DCS. Disease of bones, osteoporosis, and osteomalacia. There is defective osteoid tissue, bone mass is lost. In osteomalacia, there is defective mineralization, resorption of calcium from the bone. Disease of the joints, acute arthritis, especially hip joint. Then also animal is unable to get up. Various foot diseases, laminitis, inflammation of laminae of the foot or sole. There are fissures on feet, disease of brain and CNS, central nervous system, encephalitis. They also causes paresis and paralysis. There is peripheral nerve paralysis, obturator nerve, femoral nerve, and other nerves. There are many metabolic diseases also produce somewhat similar symptoms like DCS. Milk fever is one, hypomagnesemia, transit fever, ketosis, fatty liver, phosphorus deficiency, and paralytic myoglobinuria. All these diseases produce similar symptoms to that of DCS. Again, the list of diseases that are required to be differentiated list is not less. Nutritional, mineral deficiency, and vitamin A deficiency. Many toxemic conditions. Some of the acute infectious disease, black quarter, tetanus, botulism, rabies, parasitic diseases, tick paralysis, babesiosis. Other diseases, weakness of hind limb, weakness in animals, ephemeral fever, viral disease, acidosis, foreign body, TRP, pneumonia, pyelonephritis, heat stroke, severe trauma on the hind limb muscles, dislocation of the joints, rupture of ligaments, rupture of muscle, carving injury, metritis, damage to spinal cord, rupture of uterus. So we have seen etiologies are many. At the same time, the diseases are also many. So it is very difficult to provide diagnosis as well as treatment also. Treatment of Downer cow syndrome. We have seen many etiologies. Provide etiological diagnosis and correct the cause. Provide the rational treatment with the knowledge of pharmacology, knowledge of pathology, and knowledge of disease. Here, the treatment is not a specific because to pinpoint a specific cause is uncertain. So, treatment is generally given symptomatic. Some supportive treatments with injection of magnesium salt, phosphate, corticosteroid have shown some success. Stimulant tonics, a very important for muscle antioxidant. Don't forget this vitamin E and selenium injection. Vitamin E and selenium both are companion, goes hand in hand. So for the muscle, this vitamin E and selenium important. Give intravenous solutions containing potassium, phosphorus, calcium, and magnesium. Of course, the blood level of these are normal, but they can support the animal. Fluid therapy, as the animal is taking moderate food, not sufficient, fluid intake is less, so provide oral and parenteral fluid therapy. Important thing is here when the animal remain lie down for a long time, provide comfortable bedding because the hard surface may cause constant pressure on the skin and the skin that is under pressure may get necrosis. There may be a debuccal ulcers that is difficult to heal. When the animal sit down for a long time, turning of cow from one side to the other side to prevent bed sores and decubital ulcers. Provide physiotherapy to avoid muscle damage. Give massage to the muscle. Give the hot fomentation also. Provide non-slippery ground surface. If there is infection, give antibiotic for septic conditions. Give anti-inflammatory drug to kill the pain. Give analgesic drugs and make the animal to stand by slings or any other lifting device that will help to some extent. Provide very good nursing and care. But everything all right. Your diagnosis is perfect, treatment is perfect. But if there is ischemic muscle necrosis, the response to treatment is poor. If there is severe ischemic muscle necrosis, then there is no improvement or response to the treatment. Remember this thing. Your diagnosis is perfect, your laboratory diagnosis is perfect, your differential diagnosis is perfect. But if there is ischemic muscle necrosis, which are useful for standing up the animal, make the animal to stand, that will not give a proper response. So if etiological diagnosis is proper, then treatment will be very rational. The diagnosis also require laboratory help, estimation of serum electrolytes because electrolyte imbalance or deficiency also causes DCS. Persistent hypophosphatemia, hypokalemia, decrease potassium level with hypophosphatemia, toxemia, diagnosis of the toxemic disease, and malnutrition. So you have seen here that diagnosis of disease is easy, but etiological diagnosis is little bit difficult. It requires patience, examination, and experience. Friends, thank you very much for observing the Dr. Wait video. Share to our friends, subscribe. I prepared this video to provide a good academic, theoretical, and practical knowledge to our veterinary friends. Thanks.